Understanding reproductive health is about more than just having babies. It's about having the power to decide if, when, and how many children to have. It's about men and women having access to accurate information and quality healthcare services. This includes information about contraception, pregnancy, and sexually transmitted infections. But reproductive health goes beyond the physical. It's also about emotional and social well-being. It's about having healthy relationships built on respect and equality. It's about understanding our bodies and feeling confident in our reproductive choices. When we talk about reproductive rights, we're talking about the freedom to make choices about our own bodies and futures. This means having access to safe and legal abortion services. It also means being free from coercion and discrimination when it comes to reproductive health care. Reproductive health is essential for individuals, families, and communities to thrive. By prioritizing reproductive health, we empower individuals to lead healthier, more fulfilling lives. India has a long and complex history when it comes to family planning. In the 1950s, India became the first country in the world to launch a national family planning program. This program focused on population control through sterilization. While well-intentioned, this early approach faced criticism for its coercive methods and lack of focus on women's rights. Over time, India's family planning programs shifted towards a more rights-based approach. Today, the Reproductive and Child Health Program stands as a testament to this progress. RCH initiatives provide a wide range of services, including maternal and child health care, family planning counseling, and access to contraceptives. These programs have contributed to a significant decline in India's fertility rate over the decades. However, challenges remain in ensuring equitable access to these services, particularly in rural areas and among marginalized communities. For generations, conversations about sex and sexuality have been shrouded in stigma and silence in India. This lack of open dialogue has real consequences, particularly for young people. Without access to accurate information, young people are more vulnerable to sexually transmitted infections, unintended pregnancies, and sexual exploitation. Comprehensive sex education is crucial for empowering young people to make informed decisions about their sexual health. While sex education is slowly making its way into some schools, there's still a long way to go. We need to create more open and inclusive platforms for young people to learn about sex and relationships. This includes age-appropriate sex education in schools, as well as community-based programs that address local needs and cultural sensitivities. Parents, educators, and community leaders all have a role to play in breaking down taboos and fostering open communication. Contraceptives give individuals and couples the power to plan their families and prevent unintended pregnancies. There's a wide range of contraceptive methods available today, each with its own advantages and considerations. Condoms, for example, not only prevent pregnancy, but also offer protection against sexually transmitted infections. Oral contraceptive pills are another popular choice, offering a highly effective method of pregnancy prevention. Other options include intrauterine devices, injectables and implants, which provide long-acting reversible contraception. It's important for individuals to consult with healthcare providers to determine the most suitable contraceptive method for their needs and preferences. Access to a variety of affordable and reliable contraceptive options is essential for empowering individuals and couples to make informed choices about their reproductive health. Section 5. Medical termination of pregnancy, safe and legal access. Medical termination of pregnancy, or abortion, is a sensitive yet crucial aspect of reproductive health care. India legalized abortion in 1971 under the Medical Termination of Pregnancy Act. This law allows women to access safe and legal abortion services under specific conditions. These conditions include cases where the pregnancy poses a risk to the woman's physical or mental health, as well as cases of fetal abnormalities. Despite the legal framework, social stigma and practical barriers often hinder women from accessing safe abortion services. It's crucial to ensure that women have access to accurate information about their rights and options when it comes to MTP. Additionally, healthcare providers need to be trained and equipped to provide non-judgmental and compassionate care to women seeking abortion services. Section 6. Protecting ourselves, understanding and preventing STIs. Sexually transmitted infections are a significant public health concern globally, including in India. STIs can have serious health consequences if left untreated, including infertility and increased vulnerability to other infections. Common STIs include HIV/AIDS, syphilis, gonorrhea, and chlamydia. Raising awareness about STIs, their modes of transmission and prevention methods is crucial for reducing their spread. Condoms remain one of the most effective ways to prevent STIs. Regular testing is also essential, especially for individuals who are sexually active with multiple partners. Open communication with partners, reducing the number of sexual partners, and getting vaccinated against certain STIs like hepatitis B are additional steps individuals can take to protect themselves. Section 7. When dreams are delayed, infertility and assisted reproduction. Infertility affects millions of couples worldwide, causing emotional distress and impacting their dreams of starting a family. Infertility can stem from a variety of factors, affecting both men and women. Advances in medical science have led to the development of assisted reproductive technologies, or ART, that offer hope to couples struggling with infertility. These technologies include in vitro fertilization, intrauterine insemination, and surrogacy. However, access to ART remains limited due to its high cost and lack of awareness. Additionally, ethical considerations surrounding surrogacy and other ART procedures require careful consideration and regulation. Section 8. Bridging the gap infrastructure and access to care. While India has made commendable strides in improving reproductive health care, significant challenges remain in ensuring equitable access to these services. Geographic barriers, poverty, and social inequalities often prevent marginalized communities from accessing quality reproductive health care. Strengthening the public healthcare system, particularly in rural and underserved areas, is paramount. This includes increasing the number of trained healthcare providers, improving infrastructure, and ensuring the availability of essential medicines and supplies. Mobile clinics and telemedicine can play a vital role in reaching remote communities and bridging the gap in access to care. Community-based health workers can also play a crucial role in raising awareness, providing basic services, and linking individuals to higher levels of care. Section 9. Real lives, real stories, triumphs in reproductive health. The impact of improved reproductive health care is best understood through the stories of individuals whose lives have been transformed. From a young woman in a rural village who accessed contraceptives and was able to pursue her education, to a couple who overcame infertility through IVF and welcomed their long-awaited child, these stories highlight the power of reproductive rights. There's the story of a community health worker who tirelessly educates her community about STIs and empowers women to take control of their sexual health. These stories remind us that reproductive health is not just about statistics and policies, it's about real people, real lives, and real hopes for the future. Section 10. The future of reproductive health, a call to action. Reproductive health is not just a woman's issue, it's a societal issue. It's about equality, empowerment, and the fundamental right to bodily autonomy. As we look to the future, we must continue to invest in research, innovation, and advocacy to address emerging challenges in reproductive health care. Climate change, for example, is increasingly impacting reproductive health, with rising temperatures linked to preterm births and other complications. Access to safe abortion services is also under threat in many parts of the world, jeopardizing women's lives and well-being. We need to work collectively to ensure that everyone, regardless of their background, has the information, resources, and support they need to make informed decisions about their reproductive health. By prioritizing reproductive health, we invest in the well-being of individuals, families, and generations to come.